The goal of delivering inhaled anesthetics is to produce the anesthetic state by establishing a specific concentration of anesthetic molecules in the central nervous system. This is done by establishing the specific partial pressure of the agent in the lungs, which ultimately equilibrates with the brain and spinal cord. The pharmacokinetics of inhalational anesthetics involves their uptake through the lungs, distribution into various tissue groups, metabolism by liver, and elimination primarily through the lungs. Please refer to my video on general pharmacokinetic principle for more information. The movement of an inhalational anesthetic from the anesthesia vaporizer to the brain begins with the delivery of an inhalational agent which is mixed with oxygen, nitrous oxide or air in a controlled concentration. This mixture called fresh gas flows through the breathing circuit and reaches the patient's lungs during inhalation. The concentration of an inhalational anesthetic in the gas mixture delivered to the lung is the inspired gas concentration. Once in the lungs, the anesthetic enters the alveoli, where its concentration called alveolar gas concentration creates a partial pressure that drives diffusion into the pulmonary capillary blood. The concentration of anesthetics in the blood is called arterial gas concentration. The anesthetic is then transported via the arterial blood to the brain. The anesthetic effect is achieved when the partial pressure of the agent in the brain, blood and lung equilibrates. Again, the detailed explanation of partial pressure and concentration is discussed in vaporizer video. The link is provided in the description. As we have seen, the final concentration of anesthetics in the brain is the result of the anesthetic concentration in fresh gas flow, inspired gas, alveolar gas and the arterial gas. These four gas concentrations determine the uptake and distribution of anesthetics to the brain and other tissues. We will discuss them next. Fresh gas flow is a mixture of gases such as oxygen, air, nitrous oxide, and inhalational anesthetics delivered from the anesthesia machine to the breathing circuit. The concentration of anesthetics in the fresh gas flow is determined by the flow meter and vaporizer setting. Fresh gas flow supplies anesthetic gases to the breathing circuit, reducing the influence of dilution from exhaled gases. It directly affects the inspired gas concentration by determining how quickly the desired concentration of anesthetic gases is established and maintained in the circuit. The inspired gas concentration refers to the concentration of the anesthetic or any gas in the gas mixture that is delivered to the patient's airways. The concentration of anesthetics in inspired gas depends on the fresh gas flow, breathing circuit volume, circuit absorption and rebreathing. High fresh gas flow ensures the inspired gas concentration is high by rapidly replacing exhaled gases, minimizing dilution. So high fresh gas flow is used to speed up induction of anesthesia. Low fresh gas flow on the other hand allows mixing with exhaled gases, delaying rise in inspired gas concentration. The breathing circuit includes the tubing, reservoir bag, and other components. Before the inspired gas concentration rises, the anesthetic must fill up the circuit volume. A larger circuit volume dilutes the anesthetic gases, delaying the buildup of the inspired gas concentration. The absorption of anesthetic gas by components of the circuit such as rubber tubing materials or soda lime in the CO2 absorber reduces the effective rise of inspired concentration, particularly at the start of anesthesia. Absorption of gas by silicon and plastics is less compared to the rubber tubing. Rebreathing occurs when exhaled gases containing carbon dioxide and some anesthetic agent are returned to the patient. Exhaled gases which contain lower anesthetic concentrations after uptake by alveoli mix with the fresh gas, reducing the inspired concentration unless compensated by a high fresh gas flow. Rebreathing occurs when we use low fresh gas flow and circuit with semi-closed system. Please check out my anesthesia breathing system video 2 to understand why.